Have you ever noticed that whenever people talk about Ayurveda and modern medicine, the conversation almost every time turns into a debate? People ask, which one is better? But I think that's a wrong question. A better question is, what was each system actually designed to do? Think about this for a moment. If someone breaks a bone, has a heart attack, or is in a serious accident, no one is thinking about herbs and home remedies. They need emergency care, surgery if required, and immediate medical attention. Modern medicine has completely transformed healthcare in these situations. It has saved millions of lives through antibiotics, vaccines, advanced surgeries, life-saving medications. There is absolutely no doubt about its importance. But now imagine a different person. Someone who has had acidity for years. Someone who wakes up tired every morning. Someone who constantly feels bloated after eating. Someone who is always stressed, doesn't sleep well, and feels like something isn't right, even though most of their blood tests are normal. Is this the same kind of problem? Not really. And this is where Ayurveda offers a different perspective. Ayurveda literally means the science of life. Its primary goal was never just to treat diseases. Its goal was to help people maintain health and prevent disease before it becomes severe. One of the most fascinating ideas in Ayurveda is that disease doesn't usually appear overnight. Before a disease develops, the body often gives subtle warning signs. Maybe your digestion isn't as good as it used to be. Maybe your sleep is not good. Maybe your energy is now low. Maybe you feel stressed often. Maybe your appetite has changed. Your bowel movements have changed. And Ayurveda teaches us to pay attention to these early signs instead of waiting until the body is forced to express disease. Another thing that makes Ayurveda unique is that it doesn't ask, what disease does this person have? It also asks, why did this person develop the disease in the very first place? Let's take acidity as an example. Two people can both have acidity, but the reasons may be completely different. One person may eat irregular meals because of the work, another may be under constant stress. Someone else may consume excessive spicy and processed food. Another person may sleep very late every night. The symptom is the same, but the cause are different. That's why Ayurveda focuses so much on understanding the individual, their lifestyle, the sleep, food habits, every person's natural constitution, that means Prakriti. It tries to understand the whole person rather than only the disease. Now, this doesn't mean Ayurveda and modern medicines are enemies. In fact, I don't think they have to compete at all. Imagine building a house. You need an architect to design it. You need an engineer to make it strong. You need electrician, plumber, carpenter, and many other professionals. Each one has a different role, and together they create something complete. Healthcare can work in similar way. Modern medicine is exceptional for emergencies, acute illnesses, infections, trauma, surgeries, and situations where immediate intervention is needed. Ayurveda focuses on lifestyle, prevention, digestion, stress management, healthy routine, supporting long-term well-being. Different systems, different strengths, different purposes. The important thing is knowing when each approach is appropriate. At the same time, it's important to stay balanced. Ayurveda is not magic. Modern medicine is not perfect. No healthcare system has all the answers. Anyone who claims that one system can solve every health problem is oversimplifying something that is actually very complex. Good healthcare requires knowledge, critical thinking, clinical experience, and the most importantly, understanding the needs of each individual patient. Next time someone asks you which is better, Ayurveda or modern medicine, maybe don't choose a side. Instead, ask a better question. Better for what? Because once you ask that question, the conversation changes completely. My goal with this channel isn't to convince you that one system is superior to another. My goal is to help you understand health more deeply. We will talk about digestion, sleep, stress, nutrition, daily habits, preventative healthcare, Ayurveda, and the science behind living a healthier life. Because better health starts with a better understanding. If you found this video helpful, I would really appreciate it if you subscribe to the channel and share this video with someone who enjoys learning about health from a balanced perspective. I am Dr. Simran Lakhotra. Thank you so much for watching, and I will see you in the next video.